Hello, myself Dr.Nileema Shisode. Today, I want to introduce you a Ayurveda software which is very useful for a clinician. It will reduce your paper burden in clinic and you will be very user friendly. This is the very first page of the software. When you click on the username and password, you will find this page. The first is new patient's data. The second is the patients who were already in your list. When you click on this second, you will get that info. And if you want to modify the data, then the third is. And the fourth one is to see the patient's data in a single glance. Now we are clicking on the second folder where all your patients' data is saved. You can find your patients according to their ID number, according to their name. Here you will put patient's ID number and then you can find the data against that particular date. This way we open the patient's case paper. Now you can see the very first page where patient's name, address and all these things are shown. This is the fourth entry where you can see patient's information in a single glance. This first, you can see the visit details of that patient. You can see the systemic findings of that patient. You can see all the related information which you put in your software till date. Now here in the second box you can see the patient's information about his investigations or general examination. This is a page of general examination where you can find his BP, his weight, his pulse rate and all these things. The second is about investigations, the blood investigations which you put in that. And then third is the other investigations, MRI, X-ray, ECG findings, UHG findings, all these things. And this last one is about medicines. Whatever medicines up till now you prescribe to that patient, that also you can see in a single glance. Now you will see the further information about the patient. Here you can find that when you click on the second page, that is visit details, here you can put all the information in that visit, means clinical findings or patient's complaint. The second page is about the symptoms and since what days they are there and upashay anupashay. This is a family history page. Here you can see the family history of patient. Now we will go to the examination of patient. So rasavaha, raktavaha, then maunsavaha, all the things are included in this particular. Medovaha, you can say medovaha, asthivaha, strotas, Majjavaha, Astivaha. No, this is a Medovaha Strotas. Here obesity and diabetes. Both case papers are separate. You can see them. All the symptoms are included here. Then this is a Astivaha. In that Astivaha, orthopedic symptoms, because we have more and more patients of the orthopedic department. Then here is Upadhatu of Asti. So it is included here. then Majjavaha, Majjavaha. Then this is a Shukravaha Srotas. In Shukravaha, Shukra Dhatu and the reproductive system symptoms are included. Then Malovaha, then Mutravaha, then Svedavaha, and the last one is a Manovaha Srotas. Manovaha is very important. Nowadays, psychosomatic diseases are there, so Manovaha symptoms are taken in detail. Now we will go to the daily routine, vihara of that particular patient. So at what time he wake up, at what time he sleep, and how his job is, all these things are there. Then we come to the dietary findings. In dietary findings, all things are included. So in drop down box, you can find the bakery products, which bakery products he is taking, since how long he is taking, in which quantity he is taking. All these things are included in this particular software. And when you take this all dietary findings of that particular patient, then certainly you come to a certain conclusion that by which dosha this patient is more and more vitiated, and then you can pay attention to that particular dosha and you will advise the treatment likewise. After that, here this is your inventory. You can say here you can find out which srotas is involved, the origin of that particular srotas, and the hetus because of which that particular srotas is involved. The respiratory system I am showing you. So here directly you can find the causes of the vitiation of that particular system, and you can directly select, or if the causes are not found in that particular patient, that you can directly omit. And this is a data for you, ready-made data for you. Here you can add according to disease also, hetus you can add with your customized. And this is the examination page, general examination, pulse, BP, then weight of patient, RS, CVS, abdominal examination, all. This is a Ashtavidha Parikshana. Then this is a Dashavidha Parikshana. Then after that, you can find out Prakruti also. The short examination of Prakruti is here. So you have to simply click. Then this is, I told you, that investigation page. The blood investigations you can add, urine examination, and you can attach reports also. You have to save that reports in your report folder of that software, and from here you can directly attach them. So you will find you can get that investigations against that particular patient ready in hand. So it is very user-friendly software. It is very easy to use. So all this is about then this is investigation number 2, means X-ray, UHG, MRI, then 2D echo, or any other investigations, special investigations you have done for that particular patient, or the patient brought some reports, then that also you can attach if you have a soft copy of it. After that, this is our Ayurveda Nidana Panchaka, Hetu, Purvarupa, Rupa, Samprapti, Dosha vitiated in that particular patient. The combination of dosha is available over here. Then Dusha, which are vitiated here, that also you can add on. Then final diagnosis, come to the conclusion. Here you can save your diagnosis, or you will have some diagnosis previously saved, but you can add also. Likewise, you can add them like this. Select that particular and then you will take the treatment plan. What is your treatment plan? Shamana, Shodhana. What is you are advising to that patient? This is a page for photo information. the before photo for hair or for skin, for what purpose you are taking, then before how the patient was looking, and after how the patient have got that particular results, that you can say over here. Then this page, now you are going to the treatment plan. In treatment plan, this is a page of Vamana, then you will get Virechana, then you will get Basti, then you can say all the things, which oil you used and how much days you are giving. This is a page of Rakta Mokshana, then this is a page of Nasya, for how many days you are advising Nasya, with which medicine you are advising it. Then this is a Rakta Dharasved, and then allied therapies. If you are doing some extra therapies in your clinic, nowadays we are doing many things: facial, food therapy, kati basti, or whatever extra you are doing, laser treatment or pills, that also you can add over there. Then this is a page of a medicines. Here you can directly select the particular medicine, then you can select dose, and you can choose kala, in which kala you are giving. All these things you can select. Here you can add also. If you bring some new stocks of patient and a stock of that particular medicine, that you can add over here. In which category you are adding the medicine, means tablet or liquid or oil or ghee, all the categories are given here. Then you have to add in that particular number or gram, all these things. Then the inventory will be automatically created, and when you will use that particular medicine against that particular patient, that will be directly deducted from the stock. And by this method you can directly find out which medicine, the particular medicine in which quantity is available with you, like this. So this is a very good software. This manages your patient's data, this manages your medicine quantity, and ghana tablet, in which quantity they are available with you, that also you can find with this particular category wise. Also you can find out, in general also you can find out. Then you can make it's you can export the data to Excel sheet, and you will have print also for your junior staff and all these things. Then this is account section. In account section also you will put that which fees you are charged, for what purpose you charge, what amount patient paid, all these things in general also you can see here. Here you can see with that particular patient which quantity, or date wise also you can find what amount you received up till now and all these things. This is now list of patients. Patient's data is there, age, address, phone number, all things are listed here. ID number is also there, patient's name is there. Again you can go to the upper box, and then you can select appointment for that particular date. So this is a date and these are the appointments, and phone number is also there, or date of birth is also there. So all primary information is there. So you can call patient and you can message him that he has an appointment today, he has to visit clinic, all these things are there. Then patient's birthday is also there. At that particular date, if patient has a birthday, then you can wish him, or you can offer him, you can give him some offer that today is your birthday. Now this is a era of this advertisement, so you have to do all these things. So this software will help you to manage your patients. Here by name also you can search the patients. There are so many things that you will not need any paper when you have this software. Export to Excel. You can see that button on the right side. With that, you can export that patient's data. Now again you will go to the upper drop down box and you can see list of Hetu, Purvarupa, Rupa, and again there is if you want to extract the data, whatever data you have put in your software, if for any paper presentation or something you want the data to extract, the tables are also made there. So if you click on that, then you will directly find. Definitely you have to put all information there, then only you can extract the data. So if the particular Hetu is responsible for that particular disease, or which kind of patient you have more in your clinic, all this data you will get from that software. Then here are the below stock medicine and above stock medicines. So below stock medicine you can see here. Then above stock medicines also you can see here. The quantity which you will put in your inventory. So minimum quantity and maximum quantity. So if the quantity is below minimum quantity, then that you can see here. Then you can send that to Excel sheet and you may have list in your hand. You can order that medicines like that. The software works. So this is a Ayurveda software. Vaidyasakha Ayurveda software. Please, if you are interested to buy this software, then let me know. It is very good for you to use this software. And this first page it will be customized page. This first page you will definitely you can put your clinic's name in it. You can put your